But bringing you this at this point, the City of Tshwane has raised the alarm about the high rate of teenage pregnancies within the capital. Public health facilities recorded nearly 10,000 deliveries to young moms in the past 2 years. The MMC for Health in the Metro, that's Rina Marx, joins me now for a talk about this and more. Rina, thank you so much for your time and good morning to you. Understandably concerning, of course, for the City of Tshwane. I just want to read just a few stats here. That between July 2019 and June of 2021, the city recorded 9,922 teenage pregnancies from 674 girls who, of course, gave birth between the ages of 10 and 14, but a further 9,248 girls aged between 15 and 19 years, also gave birth. I can imagine how alarming this number is. Just take me through how much of a problem this is for the city.
Yes, good morning. This is a huge concern to us and a huge problem in our city, and we really want to focus on taking this forward and see if we can maybe assist in the community to make this problem a little bit less with the stats that we've got since 2019 and 2021. The teenage deliveries are really a high concern, and we really want to make a difference in this.
Yeah. With that being said, we often have these conversations around teenage pregnancies, but when are we going to have a conversation around statutory rape, Rina? If we're talking about young girls between 10 and 14 or 15 and 19 being pregnant and giving birth, doesn't the city also have a problem of statutory rape?
Yes, unfortunately, we don't have, on the national data collection tool, does not collect data on the rape and incest because of the confidentiality around this. However, those who do report a rape offered within 72 hours, they get pregnancy tests, free post-exposure prophylaxis to prevent HIV infection, emergency contraception to prevent pregnancy, and provide counseling and testing for HIV, assessment of sexually transmitted infections. Because of the POPI Act in place, we are not allowed to ask these girls whether they've been raped or not, unless they ask for advice and help to refer them for counseling and for further help in the hospital facilities.
Right, so you don't have the full profile of, the girls in terms of what exactly happened, how they got pregnant, and thus you can conduct more further data on this. But surely this nonetheless has, socio-economic consequences for these girls and these communities.
Yes, it does have a huge impact on the socio-economic services because of these girls are some of them are dropouts from the school, and it places there's still a problem of what do I want to call this? High incidence of these they abandoned or give up these little babies for adoption, which places an additional burden on the child welfare system. Furthermore, teenage pregnancy present other challenges with increased health, education, school dropouts, and financial stress on the communities.
Yeah, I mean, we need to call a spade here. This is risky sexual behavior, and I just wonder at what point do we have to sort of educate or even enforce more sexual education in school so that young girls are aware of their bodies, they know about the consequences of some of these sexual activities, and how, of course, parents and community members and society can also assist here. What do you suggest can happen to prevent these numbers from further exacerbating?
I know that basic education do have programs in the schools to help these girls to understand the risk of having early pregnancies. But because of COVID, the last 2 years, this has been put on hold. But we do inform the teenagers and the parents to visit our municipal clinics for the following services. They can have relevant information on teenage pregnancies, choices of possible of the pregnancy and available contraceptives. The facilities also provide health promotion leaflets that are available in various languages, free contraceptives in the schools, happy hour sessions between 14 and 15 hours daily in the clinics, where the teenagers get preference to receive related health services and advice. Now is the time for us, both as a city, including the parents, teachers, church leaders, and the community at large, to act decisively to help our future leaders and to make informed and responsible decisions for them.